Good evening, ladies and gentlemen, boys and girls, and any transgenders watching my live chat show. Being social, as I always say, being social, I try and bring you in conversation with some inspiring minds and personalities each time. And this time, my esteemed guest is Dr. C. Naveen Kumar. Dr. Naveen Kumar is a professor of psychiatry in NIMHANS, National Institute of Mental Health and Neurosciences, premier organization, work under the central government. And apart from being a professor of psychiatry, he's also head of community psychiatry in NIMHANS, and he does a lot of add-on works which we'll hear from him. He has contributed many professional papers on the subjects in Indian and foreign journals I saw from my own research. And Dr. Naveen Kumar, welcome to this live chat show. And it's just a heart to heart talk, nothing formal about it. Basically, our viewers uh, like to interact. Sometimes, if they have any questions, they will ask, and we will try and satisfy their queries.
Sure, sir.
So,
Thank you very much, sir.
so
Thanks for
with
having me
that,
on the show.
brief introduction, Dr. Naveen Kumar, let's start with your early education and how you reached NIMHANS. Please tell us.
Sir, I am born and brought up in Bangalore. I'm a Bangalorean. So I had my early education in Bangalore only. For my medical graduation, I shifted to Mysore. Mysore, as one knows, it's the cultural capital of Karnataka. And after completing my MBBS in Mysore, I joined NIMHANS through a national entrance examination. First, I did the diploma in psychological medicine 2001 September to 2003 August, and soon after I joined MD in psychiatry. That was 2 years at that time. So August 2005, I completed the senior residency in the junior residency in psychiatry. And after that, for about 2.5 years, I worked as a senior resident or the senior registrar, which is a position between being a student and a faculty member. It's an in-between position. So after 2.5 years there, I joined as a faculty as assistant professor of psychiatry in Bangalore Medical College and Research Institute. I was there for about 30 months. And after that, I joined NIMHANS as a permanent faculty member. So I am working in NIMHANS from May 2010 onwards as a faculty member of the Department of Psychiatry. From I was initially the assistant professor, and I'm currently promoted to professor. And other responsibilities, as you have said, sir, I head the community psychiatry services at NIMHANS. I'm the officer in charge of the NIMHANS Digital Academy. I'm also the officer in charge of the Center of Excellence on Mental Health and Climate Change as part of the National Program of Human Health and Climate Change. I also look after, I'm also the consultant for forensic psychiatry and telepsychiatry. So this is my brief introduction, sir. Thank you.
Thank you for that. Some of these new things I also learned that you have a digital excellence center in the NIMHANS also,
Yes,
and
sir.
there are climate change and mental health. I mean, this is something news to me. We'll as we go along, we'll talk about these also.
Yeah,
So, upfront, Dr. Naveen Kumar, let's talk about mental health. There are a lot of
right.
people, even today, the educated ones like me, who think that mental health means something to do with the people with infirm mind or controlled, uncontrolled activities or lunatics. So while the mental health is much more elaborate and useful area. So,
Yeah.
could you tell us what does mental health do and how it is different from psychiatry. Of course, there will be linkages.
Right. Sir, mental health, there is no health without mental health. Let us begin that way. And mental health, as you may be aware, is part and parcel of the overall health. For example, the WHO gives the definition of health. The WHO stands for the World Health Organization, and it says the health is a complete state of uh, physical, mental, social, and spiritual well-being, not just merely the absence of disease or infirmity. So that is where mental health is. So that is one idea about the mental health. Coming to the definition of mental health can be thought of as a state of mind, or a state of well-being, so to say, which helps one person mental health refers to the cognitive, behavioral, and emotional well-being. It is all about how one thinks, feels, and acts. It is more than just the absence of mental disorders or disabilities. It is a state of well-being in which an individual realizes their own abilities, can cope with normal stressors of life, can work productively, and is able to make contribution to the community. So these are the various facets of mental health, I would say. If a person has good mental health, he or she has to fulfill all these criteria. That said, mental health is often mistaken for psychiatry. So psychiatry and mental health, although are related, there is a difference that one needs to understand. Psychiatry is a medical branch of dealing with disorders of the mind. Like, for example, you said infirmity or lunatic. So those generally are pejorative terms that used to be present long before for those with severe mental disorders. Now, when I mean psychiatry, I am dealing only with diseases or disorders, not otherwise. So, psychiatry or psychiatric disorders can be divided into two or three sub divisions. One is severe mental disorders. Severe mental disorders, affect about 1% of the population. It is present throughout the world without any variation. Everywhere you go, 1% of adult, roughly 1% of the adult population, they do suffer from either schizophrenia or bipolar. These are the two quintessential severe mental disorders. They are much less common in prevalence. As opposed to that, common mental disorders like, for example, anxiety disorders, phobic disorders, generalized anxiety, so specific phobias, so on and so forth, obsessive compulsive disorders. So these are called as common mental disorders. These are prevalent at the rate of about 5% of the population. The other major category of psychiatric disorders are substance-induced disorders, substance use disorders, like, for example, addiction to alcohol, inability to control intake, addiction to tobacco, addiction to so many other new drugs are coming, nowadays, opioids, cannabis, and so on and so forth. So these are the broad three categories of psychiatric disorders. Now, mental health is a much broader concept in the sense mental health includes preserving our own mental well-being and the activities that are important to preserve that mental well-being, which is called as promotional mental health or mental health promotion. The other aspect is preventive mental health. Some of the activities that we do to prevent the origins of mental health, that is called as preventive mental health. Uh, like, and of course, mental health also includes psychiatric disorders. So, while psychiatry deals with only diseases and how to treat them, mental health is a much, much broader concept which includes preventive and promotive aspects. Like, for example, doing yoga or indulging in spiritual practices may help people in preserving their own sanctity, in preserving their own mental well-being. That is an example of a promotive mental health or mental health promotion, or for example, teaching life skills to children of school, because WHO is a big, very big advocate of life skills education, and it advocates training of life skills for children. So that is done to prevent, say, depression or something like that. So that is an example of preventive mental health. So I hope I am clear, sir.
Thank you. You used the term mental well-being. So I'm
Yes.
tempted to say that normally when we read about spiritualism and meditation and good behaviors in our own
Yes.
systems across the world, so we talk about divine virtues like abating anger, being concerned, care
Right.
and compassion, sharing and caring, and being a good parent, good student, good boy, good children, good sibling, all those things. So, do they also fall under mental well-being because they are the triggers? If they are not in harmony or they are not taken in the right spirit at right times, then they may be counterproductive and interfering with your mental health. Eruptions of different
Yeah.
kinds, emotional outbursts, anger,
Right.
fights, quarrels, and all that.
No, that's true. See, in mental well-being also, you should understand it. If you divide it further, it can be thought of as emotional well-being, wherein emotional well-being is defined as the ability to understand and manage one's emotions, including resilience and the kind of ability to face the setbacks. That is emotional well-being. Psychological well-being, how to function internally, including the ability to process the information and maintain a perspective on life. And of course, social well-being, ability to form and maintain healthy relationships and connect with others. So all these three things, mental health and mental illnesses should be differentiated. Mental illnesses come under the rubric of psychiatry. Mental health is a continuum that everyone has, fluctuating between good and poor, depending on the life circumstances. For example, I'll give you one other example. A person who feels sad. Sadness is a universal human emotion that everyone in this world, they undergo sadness many times. They keep undergoing, they keep feeling sad. But there are certain conditions when we say sadness to be an illness. No, not every person who feels sad, we call them as having a depressive disorder. For sadness to become depression, there has to be certain criteria, or there are only after the sadness meets certain conditions, we call them as a disorder. For example, if a person loses a loved one, the person feels sad for maybe that lasts for about 1 week or 2 weeks. But the same sadness, if it is present for more than 1 month, if it is persistent and pervasive, that is, if it intrudes into each and every activity of the day, and if the sadness is present continuously, across spread across all activities, if it is associated with extreme fatigue, if the sadness is associated with inability to enjoy previously pleasurable activities, if it is associated with reduced concentration, if it is associated with thoughts of helplessness, hopelessness, worthlessness, if the sadness is associated with feelings of guilt, if the sadness is associated with reduced intake of food, reduced weight, reduced, decreased, sexual activity. So if these associated features are present for at least a period of, say, 2 weeks, then we call that sadness to be pathological. Then the sadness is thought to be abnormal. So likewise, mental illness also forms, they fall under the continuum of mental health, and there has to be certain criteria or certain conditions which need to be met for us to consider mental illness and to consider treatment. you know that is, these are some other additional points about mental health and mental illness.
Yes, and you brought in the new dimension of relationships and role of psychological interventions and counseling.
Right,
So, whether it is grief counseling or any other relationships counseling, so these are something which is the need is felt by people of all ages these days, and now people are not hesitant also to go in for counseling
right,
as a prevention to the erosion of relationships, as well as
right,
getting into difficult mental conditions. So,
right.
would you like to tell us a bit on that?
Bit on what, sir? Bit on what?
On this role of counseling and psychological interventions
Right.
amongst normally healthy people.
Um, See, the counseling is counseling and like there is difference between mental health and mental illnesses. Counseling is a very broad term, and counseling also is counseling is also we need to also differentiate it from what is known as psychotherapy. Okay, like the differences between counseling, a counselor or a psychologist is something like this, sir. Counselors are usually graduates or master level graduates, while psychologists or the psychotherapists, they are doctoral degree holders, or they have done some specialization in clinical psychology. While the psychiatrist is a medical degree, it's after doing MBBS, psychiatrists are doctors. Psychologists are not medical doctors. They are specialists in treating psychiatric problems using psychological means. Counselor is a more general term. The focus in counseling is specific life issues and emotional coping, like what you just now said. While for a psychologist, the focus will be on the behavioral patterns and psychological testing assessment, like, for example, doing the IQ, the intelligence quotient assessment, or assessing the specific learning disabilities. And these are the aspects that the psychologists deal. And of course, they cannot prescribe any medications, both psychologists as well as counselors. And diagnosing or finding out mental health problems or mental health illnesses, the counselors do not usually do, while the psychologists may attempt to do, but definitely that falls under the realm of a psychiatrist. As well as counseling is actually generally done for many life problems, or as I was saying, specific life issues. Like, for example, relationship counseling is one very popular form of counseling that is in vogue, in particularly in cities. The relationship counseling or the marital therapy, the core objective of this relationship counseling, what happens in this marital counseling is, some three or four things I would say. One is to improve the, I am just giving one example of counseling. There are so many different types of counseling, so many counseling is done for various problems. But relationship problem is one of the core issues that come for counseling, and that's why I'm saying some three, four important points about counseling are marital counseling are improving communication, like moving away from blame cycles and learning to use statements to express needs, de-escalating the conflict, that is recognizing when to take a time out and things like that before a discussion becomes destructive, rebuilding the intimacy between the partners, navigating transitions, that is helping couples adapt to major life changes. So these are some of the important aspects of marital counseling or relationship counseling. Likewise, counseling is a very huge field. There are school counselors, there are counselors in workplaces, there are counselors in various other areas, industrial, and so it is a very, very big. I don't think we can cover all the aspects of counseling and psychotherapy in today's discussion. But I just gave you one example, one typical example of a counselor, and I've also dealt upon the differences between a counselor and a psychologist and a psychiatrist.
Thank you, doctor. Let's take some reactions from our audience. Dr.
Right.
Uma Pant says a much needed area for podcast by a renowned expert, and in few minutes in and already hooked. So thank you, Dr. Uma. And Mr. Rajendra from Uttarakhand says, "Welcome, sir. Most important topic is being discussed." There is another viewer. Um, his screen name is HRP Fatville. Um,
Okay.
says all counselors are not created equally. You have to find a good one, and it is not easy. Many don't know what they are doing. And he's also saying that psychotherapy is the best chance you have. Don't even mess with anyone else.
I don't know what that means, but yes, I agree with the first point that counselors should have solid training, and with a, but nowadays like quackery is there in medicine. Everyone with not adequate training also they call themselves as counselors, because particularly after COVID, what has happened, as we were discussing prior to the beginning, there's a huge upsurge of interest in mental health, because COVID was also called as a mental health pandemic. People affected with anxiety, depression shot up to about 30% of the population. So mental health got a lot of impetus during COVID, and after that, every person, without adequate training, also that's been a big problem. Anybody calling themselves as counselors and psychotherapists, and because the huge demand in the society now, so that is some dangers of having unqualified persons in this field. That is also a problem I would like to bring it to the notice of the viewers.
Um, Mr. Rajendra is also asking a question that which therapy is useful in cases of autism and cerebral palsy of two different areas.
Okay. The cerebral palsy, there is no psychotherapy which is very specific. I would say cerebral palsy is because of the damage to the brain areas which are important for development of motor functions. uh, you know, and like so, with the therapies are not psychotherapies, but the therapies which helps in strengthening the muscles. That is what is important for persons with cerebral palsy. There is no one size fits all. You know, Likewise, cerebral palsy has hundreds of different manifestations, and based on which muscle groups are involved or not involved, we will have to, we'll have to tailor the needs. As regards autism, autism also does not have a one size fits all approach. But some of the common therapies are behavioral therapies, I would say. One is applied behavioral analysis. This is considered the gold standard by many medical professionals. The applied behavioral analysis involves breaking the skills down into small teachable steps and using positive reinforcement to encourage them. The goal of applied behavioral analysis is to improve specific skills like looking others in the eye, listening, and imitating, while decreasing behaviors like tantrums. That is what is done in applied behavioral analysis. The other group of therapies are the developmental therapies. These therapies focus on specific skill deficits to help the individual function more independently. Like, for example, the speech and language therapy is very commonly used Almost all individuals with autism benefit from this. It addresses challenges with both verbal skills, that is talking, as well as non-verbal skills, that is gestures, eye contacts, etc. Occupational therapy is another therapy which is used in autism. OT, that is occupational therapy, helps individuals live as independently as possible. It works on, say, what is known as the activities of daily living, like dressing, eating with utensils, and bathing, etc. The other psychological and social therapies include social skills training and specialized therapies such as a cognitive behavior therapy. This helps individuals stuck in thoughts and cope with anxiety and depression. And of course, the family therapy, where family pathologies are there to correct. So I think we are moving towards more and more specialized areas, which may not be so relevant for today's topic. So I'll stop here at that.
Thank you, doctor. And Professor Chandra from Mumbai, he's asking a very general but very important question. He's saying how to keep mental wellness at all times, and how do especially the psychiatrists themselves keep it in shape.
Yeah, it is not very easy because, after all, we are all humans. And as I was previously telling, um, it lies in a continuum, and it is good if we are able to maintain our balance. Most of the times during the daytime. Sometimes here and there, um, we may lose the cool. But some of the important things, some of the general things that helps one person to keep up the mental well-being is sleep hygiene. That is, sleep is when the brain processes emotions and repairs itself. So chronic sleep deprivation is one of the fastest ways to destabilize mental health. Aiming for at least 7 hours of sleep a day. That has to be quality sleep. That is one thing. Nutrition, there is a strong gut-brain axis, as Dr. Saab would know. Diets high in processed sugars can lead to mood changes. A balanced diet has been linked to lower rates of depression. So that is one definitely one thing which we can do. Movement, that is exercises. Exercises release endorphins, dopamine, and serotonin. We need not run marathons, but at least 30 minutes of walking can significantly reduce, cortisol and stress levels. These are the three important things to maintain well-being. That, of course, these things apply to psychiatrists also and mental health professionals. Practicing mindfulness, that doesn't necessarily mean meditation. It means staying in the present. And depression often lives in the past. The present is usually manageable. And setting boundaries, that is saying no, being assertive. Having social connections are very, very important. Nowadays, people are saying loneliness is the new smoking. So being connected, it's extremely important for maintaining well-being. Having a routine and structure. For example, some rituals in the morning or evening, and enjoying small wins. So these are some of the general things one has or one needs to follow to maintain well-being, mental well-being. And of course, these things, avoiding alcohol and other substances, or having them in moderation. So these are some of the things that one can practice to maintain well-being.
Thank you, doctor. Dr. Uma is saying that once I heard parents are the best informal counselors, and also everyone counsels oneself at some time or the other. She's asking you a question. In your
Right.
experience, what is something everyone should understand about the mind?
Okay. So what is mind? That is the basic question. This question has bothered, philosophers and thinkers for for thousands of years. So it's a very complex question. But to answer it very simply, what I would think is, we all know mind is there because brain is there. But brain we can see, mind we cannot see. Mind is the functional, aspect of the brain. To simplify it further, I would say mind as a collection of our thoughts, our emotions, our intellect, that is our intellectual functioning, our language functioning, our perceptual functioning. So all these put together constitutes mind. Of course, movement does not come, memory comes as part of our mind. So it's a collection of our thoughts, emotions, and perceptions, and our intelligence, and our other higher mental functions. So that is a very simple way of knowing what mind is. And psychiatric disorders are disorders wherein one of these components go awry. Like for example, if our certain areas are important for generating our thoughts, if there are abnormalities, functional abnormalities, I would not say structural, if there are functional abnormalities in areas that are responsible for origin of emotions, then we have what is known as the emotional disorders or mood disorders. That is what I'd like to put. It is a very simplified version, but that is how we can begin the discussion. Likewise, if if the areas of the brain that control perception, perceptual functions, then we will have perceptual disorders or perceptual abnormalities. So things like that. So again, I'd like to repeat and say that brain or mind is nothing but collection of our thoughts, of our emotions, of our intellect, of our perception, and our what is that? Memory. Thank you.
Thank you. Let's move on to another area now. Let's become a little bit modern now.
Right.
I was attending a workshop by an eminent person. His speech, very simple words. He said, as you also mentioned about the sleep requirement, he was saying mind needs silence and quiet, and the body which is there, it needs exercise, and it should be in motion, it should be doing rigorous exercise, walks and all that. So now this new animal is there in the market, the digital gadgets,
Yep.
etc. So what they have
Right.
done is that mind which needed calmness is busy with those sounds and actions on the digital with your fingers and all that, eyes and glued all the time, and the body is sedentary body which needed to go out, body is not going anywhere, mind is going, which is supposed to
Right.
take rest.
Right.
So this has brought in a kind of what I call is a pandemic bigger than the
COVID.
COVID-19 or anything else. Now, I give you two references to elaborate further on. Number one, the toddlers, the young ones, they are, when they get addicted to screens, they would think that the real world is that, and anything else is not important. Parents also get busy, they don't understand that these can bring in all kinds of disorders including autism amongst children, and disinterest in social activities and regular activities like that. That's for the young ones. The another one is for the adolescents and youth who are who get glued to all these gadgets, and the resultant behavior is that they are addicted to the digital gadget itself, as well as the all kinds of gaming and other activities, which can be as serious a mental disorder as the drug addiction or the alcohol addiction, because one of those I remember few years back there was one game that was being played across the world including in India, the blue whale. In the last episode, the players were supposed to commit suicide.
Right.
Thank God there were not many suicide in India, but there were. But elsewhere, the more so-called civilized and educated countries, advanced countries, many people committed suicide because of that. And so would you tell us on these two aspects? One for the young ones, the toddlers and the
Yes, sir.
kids. Second one is for the adolescents and youth. We'll talk
Right.
about the geriatrics later.
Yeah.
Thank you.
No, geriatrics, the same principles apply there also. So it is called as digital addiction, or otherwise known as the problematic interactive media use. The basic problem there is inability to control the device use despite negative consequences in daily life. As of 2026 January, there are roughly about 2 crore people, 20 crore people who suffer from one or the other media addiction. Or media addiction means addiction to digital world. It is actually fueled by the design of the internet itself, like features such as infinite scrolls, variable reward notifications, like such as likes and autoplay algorithms. These trigger what is known as the dopamine hormone inside our brain. Similar to those found in gambling, like people indulge in gambling because gambling gives that kick, just as the way alcohol gives that kick. Likewise, people who are addicted to this gaming or digital addiction, it could be children or adults or geriatric population, whoever it is, they get that kick. And uh, it is a global public health priority nowadays. I think, that there's no denying the fact. Uh, and the WHO recent report has found that about 11% of teens, that is adolescents, now exhibit problematic social media use, which has increased from 7% to 11%, which is actually a very, very, dangerous, I would say. Another bit of statistics, if I have to give, in the US, an average adult now checks their phone approximately 150 times per day. This is some research that I have done. Nearly 30% of the adults self-report that they feel addicted to their devices. So that is the big problem. That's a big problem, not only in India, but throughout the world. Like when you look at what are the harmful effects on children and adolescents, I'm mixing up answers, sir, because the many features are actually common to both. Harmful effects on children and adolescents. There is going to be a developmental impact on the brain, which has been linked to reduced gray matter volume in the regions of the brain, responsible for reward processing and executive functions and emotional regulation. So that kind of can lead to cognitive deficit, that is excessive multitasking and rapid fire content consumption are linked to shortened attention spans. Then their social and emotional growth gets affected, where teens constantly compare their behind the scenes to others. The other fellow must they have so many followers, so many highlight reels and things like that. So that they get into unhealthy comparison such as that. Next is sleep disruption. About 70% of the teens who are addicted to internet, they report loss of sleep. you know and when it comes to adults who prioritize their phones or face-to-face interactions, they report lower satisfaction in the relationships and higher level of conflicts with partners. Then there is burnout, occupational burnout. Digital addiction often blurs the line between work and home, and they 40 about many adults, they do come and keep checking the work emails even after they come back home and while on vacation, leading to chronic stress. So these are some of the impacts. Like what are the interventions, or what are the features of digital wellness campaigns? that are to be followed. One is digital detox camp, that is immersive retreat designed to reset the brain's dopamine baseline, just as the way we detox one person's who is addicted to alcohol or something. So digital detox can be practiced, and there are specialized psychotherapies called as cognitive behavior therapy, wherein the focus is on identifying the digital triggers and replacing compulsive scrolling with high value offline activities. And the other thing, policy level change that one can bring about is the age gating phenomena, or like, for example, I know Australia has banned social media use for children who are less than 16 years of age. So such kind of policies also can help in controlling this menace. Coming to young children, the problems are, excessive screen use can lead to the language delay, because for children, for language to develop, they have to actively interact with the environment, they have to see the environment, they have to listen to what is happening to them, and that is how the language develops. But that screen time, excessive screen use will not allow the child to do that. And excessive early exposure is also linked to thinning of the brain's outermost area, which is called as the cortex. This is a marker of less alert state, and which is a kind of prerequisite for conditions like attention deficit hyperactivity disorder. I've also picked up some guidelines which is given by the WHO for kids. That is age group of 0 to 18 months. Recommended daily limit is zero screen time. Exceptions can be video chatting with family, as it is interactive. So 18 to 24 months of age, minimal or near zero, recommended daily limit. 2 to 5 years, it's maximum 1 hour. So these are some of the things that I would like to emphasize, sir, with regards to digital addiction and the problems in children and adolescents and adults. Thank you.
Thank you. There's another question by a viewer that if a child has very good IQ and all developmental milestones are in normal range, but hesitant to participate in any of the social settings, what could be simple practical intervention
Ah,
and also interventions for adults?
Yeah. No, I think one of the things that we need to do is to assess only in some social setting, is it, social anxiety could be one possibility. If that is the case, then, a small graded exposure, you draw up a hierarchy of social situations in which the child is not wanting to interact, and have the exposure very gradually, the stepwise exposure is what we say. That kind of behavioral interventions can help the child. In other words, the other things that could be done is to evaluate thoroughly for presence of any other anxiety disorder, and if that is present, the same the requisite treatment has to be started. Thank you.
Um, and if the hesitation is only in some of the social settings, then
Yeah, I
what
think
could be the
then the graded exposure is what we call, sir.
okay?
Yes.
Another question for you is that once someone has psychiatric issues and is under medication, can he or she be fully treated or relapse is possible? If yes, how to avoid relapse?
Yeah. So this is a very, very general question, but the answer depends on various contexts, I would say. Uh, but to give a general response, many psychiatric disorders are chronic disorders or relapsing disorders. One example, typical example of a psychiatric disorder is schizophrenia. Schizophrenia is a chronic illness, let us put it that way. Because once the label of schizophrenia is put on a particular patient, very likely that the person will have the illness for a long time. Many a times it is a lifelong problem. So so the medications also are required many a times lifelong. It's just like diabetes or hypertension, since the duration of the treatment of those two problems are generally lifelong. This also, depending on the context, it should be lifelong. Whereas other psychiatric illnesses such as depressive disorders, if there is only one episode of depression, we generally treat for about 1 or 2 years and then try and stop the medications. If the depression recurs again, then it has to be 2 years to 5 years. Then third time depression, then lifelong. So it depends on various contexts, and the best method to avoid relapse is to be on regular treatment and be on regular supervision under a psychiatrist. Because the duration of treatment is a function of interaction between the patient, the patient's family, then the patient's treating team, and there has to be a discussion, and based on these discussions only the duration of the treatment should be decided. So beyond this, I think it's difficult for me to answer this general question. If there are any specific questions related to any particular patient, I can probably answer.
Dr. Saab, you mentioned about life skills.
Yes.
How important in today's world is the lifestyle and life skills, and what are these two things on which you would like to give some
Right.
guidance to our viewers?
Right. Sir, the core difference between a lifestyle and life skill is something like this. Lifestyle is, what is my lifestyle? What is that question comes when lifestyle, we talk about lifestyle. Life skill is how to, if there is any how to issue, then it becomes a life skill. Lifestyle is the way a person lives, the way a person lives, including their habits, tastes, and values. That is the lifestyle. But life skill, they are the abilities, or they are the psychosocial or mental abilities that enable adaptive and positive behavior. Like lifestyle, they are ongoing or static patterns. That is, they are the result of daily choices. But life skill are should be actively applied. And they are actively applied to solve certain problems. How are the life skills acquired? Life skills are acquired through education, training, and experience. But lifestyle is formed by the social environment, income, and personal preferences. Example of a life skill is empathy, is a life skill. Critical thinking, that is a life skill. And decision making, that is also a life skill. When it comes to lifestyle, sir, examples include diet, sleeping habit, career path, social circles, etc. Life skills are, according to the WHO, they are the abilities to, abilities for adaptive and positive behavior. They are the kind of internal software that helps one navigate the external world. The 10 core life skills, as per the WHO, include the following. One is the self-awareness, that is knowing our strengths and weaknesses and values. Next is empathy, that is understanding the feelings and perspectives of others. That is what is known as empathy. Critical thinking, that is the ability to analyze the information objectively. Creative thinking, finding novel solutions to problems. Decision making ability, that is choosing the best course of action. Problem solving is a life skill, resolving conflicts or technical hurdles, one would say. Effective communication, expressing oneself clearly and listening. Interpersonal relationships, building and maintaining healthy bonds. Coping with stress, that is managing life's pressures, that is also a life skill. And coping with emotions, that is recognizing and regulating intense feelings. Um, Life skills are the engine, that drives one's lifestyle. For example, if you have a life skills of decision making, one is more likely to choose a lifestyle that includes healthy diet and financial stability. I would like to put it that way. Another example is if one person lacks a life skill of coping with stress, then the lifestyle may eventually include harmful habits like digital addiction or substance abuse as a way to numb out. So, in contemporary mental health, interventions often focus on teaching life skills to help individuals transform a destructive lifestyle to a healthy one. Hope I am clear, sir. This is what I'd like to
Yes,
say.
yes, yes, very clear, very well summarized. Dr. Sabha, now I want to ask you, I want to take you to from the big canvas to a small area.
Okay.
We talked about the world, we talked about country, we talked about health system and all that. Now let's talk about family.
Family.
Family as a
Okay.
unit, where
Yeah.
let's talk about Indian family.
Yes.
For example, let's talk about a joint family.
Right.
So in your learnings and experiences, not your personal experiences, but by interacting with your patients or around as a community psychiatrist. So, what would you like to share with the families and communities on mental health interventions and preventive issues?
Can you just reframe the question, sir?
I'm asking you that in the family where you have
Uh,
got different set of people living, let's say grandparents, parents, children, young ones, and all that, they will have interaction. They may have less interaction. Some may have over interaction. Some may quarrel all the time. So, what is the your suggestions to them on mental health interventions, because if people constantly quarrel, it's a kind of a mental health
yeah.
condition, right? So that
No,
way.
so yeah, I understood, sir. So families do play a vital role, sir, particularly in societies such as ours. In preventing or promoting one's mental health. Not only that, but also in handling persons with mental illnesses. Unlike the West, in the West, what happens is if a person develops schizophrenia, more than the family, it is the state's responsibility, and the states look after the patients even though family is not there. But in our country, family is the main caregiver, and more than 90% of the persons with mental illness, they live along with families in our country. So their role is extremely crucial, and they act as a kind of primary immune system for the mind. Just as a healthy environment prevents physical illness, a functional family system buffers its members against psychological stress. The kind of interconnectedness and which is there, which acts as a buffer for many mental illnesses and also mental distress. Say, for example, children do not learn to manage stress by being told to calm down, but children learn to manage stress if they see their parents behave such way. That is one example. Then a stable, predictable home environment creates a kind of secure attachment between the children and the parents. Individuals with secure attachments are very less likely to develop anxiety and depressive disorders. And the lifestyle architecture, if you can talk about, the family dictates the biological clock of the home. For example, sleep schedules, nutritional habits, and screen time. You know, these are the biological foundations of mental health, as I was telling previously. So these things are built upon in a functional unit called as the families, and they also have a role as a first responder. As I was saying, even I mean, in our country, family is still the primary caregiver, and they are the I mean, and more than 90% of the persons with mental illness, they live with the family, and the families take care of them till they live. So they act as not only the first responder but also a lifelong caregiver. Like, for example, they also help in medication adherence, the expressed emotion factor we call, and I cannot overemphasize the role of families is what I would say in our context. They have a role in primary prevention, secondary prevention, and tertiary prevention, and so on and so forth. Thank you.
Thank you, Professor. Another question is again general but very important to me. What is the most common misconception people have about mental health?
Right. This is about the myths and
Yep.
realities. There are many myths, sir. One is the weakness myth. Like, for example, seeking help is a sign of weakness. You could say, I mean, you could see people telling you should be able to handle your problems on your own if you are strong enough. That is a kind of very common myth. But the reality is, seeking help is a sign of resilience and self-awareness, not of weakness. Mental health conditions are often biological or environmental, much like diabetes or asthma. You cannot willpower your way out of a chemical imbalance any more than you can willpower away a broken leg. That is one. That is one myth. The next myth is crazy. Society's impression is only crazy or insane people go to psychiatrists or therapists. But the reality is, therapy and intervention and counseling are for everyone. People seek help for grief, work stress, relationship issues and sleep problems, not just severe disorders. It is often a preventative measure to maintain mental wellness, similar to going to the gym for physical health. Then there are myths about medications. One is the zombie fear. That is, psychiatric medications will turn one into zombie or change one's personality. But the reality is, the goal of medication is to restore one's ability to feel and functions like oneself, not to sedate. If a medication makes you feel numb, we can. There are so many other ways of handling it. The other myth is the addiction myth. There is a myth called, if one starts psychiatric medication, one can easily get addicted. But the reality is, most psychiatric medications are not addictive and they do not cause any high. While some may require gradual tapering to stop safely, many people take them for a specific period to get through the crisis and then successfully stop under medical supervision. So these are some of the myths, sir, that I can say about the mental illnesses and mental health. Thank you.
Thank you. Very well said. Now, Professor, we have reached towards the end of our discussion. I have a segment called, I call it Reflects Answers. So I will not give you time to think. So you have to give one or two word answer in your view. I mean, it's more like a fun game. The
Okay.
first question is, who is more important to you, health counselor or a psychological counselor?
Depends on the context, sir.
Okay. And the next one, of course, it requires a straight answer. Digital dieting or digital fasting?
Digital dieting.
You allow kids to become responsible when their time comes, or you must intervene in the right time.
Intervention at the right time.
Finally, what we call social media, it is a social media or a social media?
uh, I, I don't know.
Anyways, these are, I mean, these questions didn't mean anything, just
Yes,
off the
yes,
cuff
yes. Right,
questions I just coined right here.
right.
Dr. Professor Naveen Kumar, thank you so much for your
Thank you.
time and detailed discussion. You brought the ocean into a bucket for us because mental health and your areas of expertise is a ocean, and we are looking for things to take home in the bucket. So hopefully our buckets are full. And before we end, would you like to say anything to the communities, because you are a community psychiatry head?
No, I would like to say only one thing. Mental health is as important as physical health, and there is no health without mental health. And also, I would also like to talk about Telemanas, sir, which is the name for the National Telemental Health Program of India, which is a 24 bar 7 mental health service. Toll free mental health service is available, and the Telemanas cells are located in all 36 states and union territories of the country. They are working 24 bar 7 Telemanas counselors. 14416 is the number. I'd like to share that number again. And for any person, anytime, for any mental health help, including depression, anxiety, sleep problems, suicidality, what one needs to do is to just call this number. This service is available in 20 different languages across the country. Nowadays, we are receiving 5,000 calls from across the country in a day, and a lot of people are getting help. So all your viewers, either for pass on this number, because mental health help is just a call away. They have to just call 14416 using their phone, including audio counseling. Video consultations are there, and there is also a facility to link up for the link up to the nearest in-person mental health services. So I like to share this number and tell about Telemanas once again. The number is 14416, and a happy new year to everyone, although it's belated. Thank you. These are my messages.
You call it Telemanas?
Yes, sir. Telemanas. 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 14416 is the number.
Telemanas. I will put it here on the top
Yes.
so that people who watch the
Yes.
recorded
Yes.
version also
14416.
can have a look at it
Yes.
later. And those who are watching right now, they can note down 14416 is the
Yes. Yes.
Telemanas
Yes.
number.
Yes. Yes.
And anybody needing,
You can pass. Yes. Yes.
you can pass
Absolutely.
it on. So
Yes.
thank
It's a
you,
government of India
Professor
program.
Naveen. It
Thank you.
was nice talking to you. My pleasure.
Thank you, sir. Namaste.
Thank you. Namaskar. Namaskara. Swasti.